So, what exactly is autism? It may not be what you think, so listen carefully. Autism spectrum disorder, or ASD, is a neurodevelopmental disorder, which means that it impacts how a child develops. Children with ASD have a combination of two kinds of behaviors: deficits in communication and social skills, and the presence of restricted or repetitive behaviors, or in simpler terms, a brain disorder that affects the communication and behavior of people. In younger kids, signs of deficit include failure to respond to their own name, disinterest in sharing objects, avoiding displays of affection, and preferring to play alone. In older kids, signs of a deficit include a difficulty in carrying back and forth conversations, lack of eye contact, difficulty in reading body language, aversion to show affection or different emotion, and just a preference to stay alone. Autism patients also display repetitive and restrictive patterns of behavior, like repetitive movements like rocking, spinning, or hand flapping. They might also insist on sameness in daily routines. They can be fascinated by details of an object but might not necessarily understand the function. There might be unusual reactions to anything involving their five senses. In 2020, the CDC reported that approximately 1 in 54 children in the U.S. are diagnosed with autism spectrum disorder, according to this data. Most children are still being diagnosed after the age of 4, though autism can be reliably diagnosed as early as the age of 2. 31% of children with ASD have an intellectual disability, 25% are in the borderline range, and 44% have IQ scores in the average to above average range. Autism affects all ethnic and socioeconomic groups, and no clear cause has been identified, but the following risk factors have been found. Your child's sex. Boys are 4 times more likely to develop autism spectrum disorder than girls are. Family history. Families who have with one child with autism spectrum disorder have an increased risk of having another child with the disorder. Other disorders. Children with certain medical conditions have a higher than normal risk of autism spectrum disorder or autism-like symptoms. An example of this would include the Fragile X syndrome. Extremely preterm babies, such as babies born before 26 weeks of gestation, also have a risk of autism spectrum disorder. There may be a connection between children born to older parents and autism spectrum